Hi, this is Jesse Seamon. I'm the program director for the new Virginia Tech Carilion Orthopedic Surgery Residency. I am here with Peter Apel, who's the associate program director and also a good friend of mine. We've got some slides that we want to show you to just give you a background about the residency in the hospital and where you'd be working. And this is something that we are super excited about. We will move through these and kind of give you guys some background about the residency. And we thank you very much for your interest in our program. We're excited to get to meet all of you soon. So kind of just starting it out by just going through the main sites. So the flagship hospital in the Virginia Tech Carilion system is a Carilion Roanoke Memorial Hospital, also called CRMH. It's a level 1 adult and pediatric trauma center. It's greater than 700 beds, and there's a new expansion under construction, which you can see here on the right of the main hospital. And they've made a huge amount of progress in that in the past 6 months. This will be your primary site for the residency. This is where you're going to spend the vast majority of your time. It's a very high volume regional referral center. It's also the biggest employer in the region. It's a great hospital. It's a great place to work. It sits at the foot of Mill Mountain, which you can see at the background. On top of Mill Mountain is the Roanoke Star, which is a kind of major landmark in Roanoke. It's got a great overlook at the top of the mountain where you can see the whole city. And there's also like really easy to access 20 miles of trails on the mountain for like mountain biking or hiking. And then there's the Roanoke Valley Greenway, which I'll touch on later, is right by the hospital, which is like 20 miles of trails for running, walking, whatever you want to do right outside of work. So for a lot of us, that's something that we do before work starts or after work or occasionally in between cases if there's time.
So the Institute for Orthopedics and Neuroscience, this is where the majority of our clinics are. We house the Musculoskeletal Research Center there as well. And we also have a hand procedure room where we do about 100 to 150 cases a month. The Institute opened up in 2016. And like I said, we have most of our clinics there as well as the procedure room.
The Roanoke Community Hospital, and keep in mind that all of these locations that we're talking about now are less than 5 minutes from like the main hospital, and everything's within a mile of itself. So you kind of just have to picture this from above, but all of these facilities are essentially, right by each other. So you're not talking about a lot of travel to get from one to the other or anything like that.
Super easy to get to.
Yeah, super easy. So Roanoke Community Hospital is essentially an outpatient OR site. We have 4 outpatient ORs right now, where we do outpatient sports, hands, foot and ankle, and we're actually expanding to 4 additional ORs there. So there's going to be 8 ORs there. Those are pretty much done now, and it's going to sort of expand into an orthopedic hospital. As the residency gets going over the next couple of years, a lot of the total joints will be being done at this facility, which will be brand new for that. There is an inpatient rehab floor on the 7th floor where those patients would be able to stay. In addition to community hospital, we have our PA and nursing schools in conjunction with Radford University. So there's a fair amount going on there. It's a really nice facility, and you'll spend some time there on those outpatient cases and total joints.
So just down the street from Community Hospital is the Roanoke Ambulatory Surgery Center. This is an outpatient surgery center where we do hand and sports mostly. This is a picture of one of the plastics residents, operating there with me. It's a great facility, always done by 3 o'clock. Great turnover times, and just a real pleasure to operate there. And you'll be able to come there with us as a resident.
And next, we have the Center for Simulation, Patient Research, and Patient Safety. This is also right down the street from the hospital. It's a brand new facility. It's incredibly nice on the inside. I've been over there multiple times and just really impressed with it. This is where you do your surgical skills block during your PGY 1 year. We also do microsurgery training here as part of your hand experience. So it's just a great place to get sort of hands-on experience in a simulation atmosphere, so that by the time you see a patient, you're a little more comfortable.
We've got Dr. Vaughn there working with Michaela, doing the microsurgery training.
So Carilion River Valley Medical Center. This is the second biggest hospital in the Carilion network, which exists throughout southwestern Virginia. This is in Christiansburg. It's only about 45 minutes from CRMH. This is where you'll spend about 3 months during your PGY 4 year on a sort of community and sports coverage rotation. So Dr. Catterson at New River Valley covers Virginia Tech and Radford University athletics. So that's an opportunity for you to get some like relatively big time sports coverage as part of your training. You also get a little bit of a community feel at the hospital. You know, what is it like to be in a smaller facility in a smaller hospital? And I think it's good to get that perspective. So it's going to be a great opportunity during the PGY 4 year. I just want to emphasize that this is a day rotation. So you'll be going up there 4 days a week, Monday, Tuesday, Thursday, Friday, and working there. But it's close enough that you can drive up there and drive back at the end of the day. There's not going to be any call responsibilities at that facility. Educational background wise, Virginia Tech Carilion Medical School opened in 2007, and we also have a long sort of history of education at Carilion Roanoke Memorial Hospital. We've actually had orthopedic residents from the University of Virginia for more than 50 years. For the past 30 years, we've had 4 residents at a time, 2 PGY 3 and 2 PGY 4, and they're doing about 25% of their case volume here. So a significant amount of their training is done in Roanoke. And that's something that we've really enjoyed. But since we're starting our own residency now, that sort of rotating relationship was sunsetted in January 1st of this year. And so there will no longer be UVA residents rotating through once the residency starts. So end of a very fun and very productive relationship. But as we pursue more expansive educational goals, it makes sense for us to start the residency. And they also have expanded their program quite a bit in Charlottesville. And so it made sense for them to have 4 residents back. So it's working out very well for everyone. We do have fellowship programs in adult reconstruction, hand and spine that have been built up over the years. And those are excellent fellowships. And so we have a pretty strong academic background here. We are not a community program. We're an academic medical center. In that vein, we started the Musculoskeletal Education and Research Center, also called MERC. This consists of 3 research fellows. We had over 91 publications since 2013. And I'm going to kick it over to Peter to talk a little bit more about this because he's the director of MERC.
Didn't you win the teaching award last year from the UVA residents, Dr. Seamon? Wasn't that you, if I recall?
Yeah, no, that was me. I got the final one, which was a great honor. I was really honored to receive that.
Yeah. So going back to research, so we've had a very active research program, since 2013. Like Dr. Seamon said, we've put over 90 articles in the peer-reviewed literature since then. Here's one of the ones that we did in collaboration with Virginia Tech. This is where we looked at driving after carpal tunnel release. It was great research that we did. Here's another one that we put in JBJS. This was on driving after rotator cuff repair. Here's another masthead from an article we put in the Journal of Arthroplasty, looking at BMI and return to the ER after total arthroplasty. So, we've had a real successful research program, and it's ongoing. We've got full-time personnel in the lab that help support our research projects.
And Peter, it's really building. I mean, even just over the past 2 or 3 years, I mean, that number's 91 now, but in 2 or 3 years, it's probably going to double because we've had a huge amount of output. And with the 3 research fellows here, and I mean, it's incredibly productive. So it's something that we're all really excited about and something that we're going to integrate pretty heavily into the residency.
Yeah, definitely.
So kind of shifting gears a little bit more about the residency program. I want to share our mission statement with you guys. We seek to train fulfilled, altruistic, and technically excellent orthopedic surgeons equipped with the problem-solving skills and academic curiosity to provide state-of-the-art musculoskeletal care to the communities they serve. And that mission statement will tie directly into our aims, which we're going to go through on the following slides and talk a little bit more about. So, Peter, why don't you get started?
So, our first program aim is to train technically excellent orthopedic surgeons. At the core, we have to be able to operate. We have to be able to teach trainees to operate. And so we're going to provide a robust surgical skills curriculum and early hands-on operative experience with an emphasis on technical mastery and one-on-one surgical mentorship in order to provide proficiency across a broad range of procedures. And this is going to include, operating, side by side, with the attending surgeon, giving graduated autonomy as residents progress through the program, so that when you come out, you have a mastery of orthopedic surgery.
Yeah, Peter, I think that like for any program and for anyone that wants to be a surgeon, that's critical. I mean, having a really good technical skill set is sort of the base of everything you're going to do. And our goal here is to train you to be
foundational.
Good. That's right. Our goal is to train you to be good at everything. We're very comfortable letting residents operate. We all have a lot of experience educating residents, and we want to give you a great hands-on experience. We want to pass on the sort of technical mastery of these procedures so that you can get out and practice and feel comfortable no matter what you're taking on. We want you to be the person in your group that everybody recognizes as a great surgeon, the person that they call when they need help, because you're comfortable with so much surgically. So this is a huge goal for us and something that's really important to us, to really give you a great surgical experience here. And we have the case volume and the teachers to do that very well. This kind of goes into our second aim, is to aid in the development of robust problem-solving skills by allowing graduated and progressive care responsibility. So problem solving is everything we do in surgery. Every day you will problem solve. Maybe
that's
something
one of
in
our
a case.
Former residents right there, reducing a pediatric supracondylar.
Yep. And no shortage of those. And I think that, and Peter, you'd probably agree with this, but I think like you and I have talked about this a lot, but so much of what you do in the operating room in your daily practice really is problem solving. There's always a new issue that comes up, or maybe there's a piece of equipment that isn't available that you were planning on, and you really have to learn to be flexible and to adjust to all types of situations. And I think like problem solving is a skill, and we sort of want to teach that by giving you a lot of responsibility, giving you a lot of discussion about the decisions we make, letting you play a part in that, because that's a big thing that you do in practice. I don't think I realized that as much as a resident. I think I was so focused on just learning how to do the procedures that I didn't think about all the problem solving and logistics that goes into getting them done. And that's something that we really want to impart on the people that we train.
Yeah. Just like the resident in the picture here, has to figure out, how to get this unstable elbow in position so they can pin it. This is an upper level resident, and he's solving his own problems. And so, by giving him progressive, care responsibility, it develops those problem solving skills.
And I will say that, like, having worked with the UVA residents for the past 10 years, I mean, that was one of the things I enjoyed doing the most, was just sort of like a problem comes up and we've worked together for a little while, and I sort of just like step back and just give them the time to work through it. And it's really fun watching people go through that process as they advance in training. And I think that's something that we're really going to be able to offer as a residency.
That's right. That's the difference between good and great surgeons. Good ones can do the case. Great ones can do the case when it's not easy.
That's exactly right. That's exactly right. So our third aim is to foster academic curiosity and promote evidence-based practice by pursuing scholarship and research activities. So we've got an extensive didactic curriculum, and everything we talk about in our didactics, everything we talk about in the OR, we're going to talk about through the lens of evidence-based. If we're doing something, why are we doing it? And kind of like saying, well, this is just the way I do it. That's not good enough. Everything should be based on evidence. There should be a reason. And so that's a big focus of this program, is saying that like what we're doing is evidence-based. How do you find that evidence, right? Early on, it's just, how do I find what's evidence-based? How do I look through the literature and sort of convert what I'm reading to clinical practice? And then as you get more advanced, how do you actually contribute to that literature? So that's going to be a big part of what we do. We've built a pretty extensive research infrastructure here with Merck, and we want you to identify clinical questions, clinical problems, and then seek the evidence to find answers. We will facilitate and help you to do that. But we're not just going to give it to you. We want you to see how we learned it in the first place and go back to the original sources. So that's something that's really important to us, is that you sort of have that academic curiosity. When you see a clinical problem, you understand the sort of proper route to go through to solve it in an evidence-based way. And so that's a big aim for our program.
It's about having a basis for your opinions, not just having an opinion.
The fourth aim of the program is to impart values of duty and service to patient and community, modeled by our own actions as faculty and exemplified in our lives and practices. I think this is absolutely critical. The biggest thing we do in medicine is serve. We serve our colleagues, and we serve our patients, and we serve our community. And I think that is foundational to a lot of the things we do. You have to have that attitude that it's a privilege to do what we do. It's a privilege to get to take care of other people. The things that we do in orthopedic surgery, they're special. It's special to get to fix some of these problems. Somebody comes into you with a really bad problem, and you get to be the one that helps them get through it and fix it. And that really has to come first. And I think Peter, from that comes a lot of the great things we do. But part of being an orthopedic surgeon is sacrifice. And I think there's times where you don't want to work late. There's times you don't want to stay late to get another case done. Or a lot of times when you really need to help somebody out, it's inconvenient. And the service and duty part of this is learning that, embracing that, seeing that in all of us. Once you really become one with those feelings, so to speak, it doesn't feel like such a sacrifice to stay late to help somebody anymore, if that makes sense.
Yeah, in my life, I see the fulfillment that comes from this specialty service that we do and how meaningful it is. And part of what, and Jesse, we've talked about this, right? That part of what we want to be able to teach our residents as they come through is that what we do is special, and that the things that we get to provide, it's a privilege to do that. And it makes the duty and service come easily, right? It's easy, to come in if you're doing something that somebody asked you to do. It's easy to take care of a difficult patient if you understand, why they are having difficulty. And so part of what we want to teach in this program is not just, how to do things when they're hard or that you ought to do things, but why doing those things that are hard are fulfilling, and then how you derive enjoyment and fulfillment from your own life by doing things that are challenging or uncomfortable.
Yeah, and I think that a big part of this job and being happy in this job is sort of first understanding that being an orthopedic surgeon, you have a duty to your community, to take care of the members in that community. And that ties into the service component of it. And I think that once you sort of accept that and get into it, you start to really enjoy it a lot more, because you realize that what you're doing really is making a difference. And I think this is really important for resilience and resisting burnout. And that's why it's one of the main aims of our program. And you're going to see us talking about duty and service a lot. And I think that's important, because that's what keeps you happy. That's what keeps you resilient, by knowing what you're doing is special and that it matters to people.
Big time.
Final aim is critically important as well, and that is provide a diverse and inclusive training environment that allows for health and wellness and resist burnout. We want you to be happy in this residency. We all have to work hard. That's part of the job. But we also want you to have balance. We want you to enjoy your time outside of the hospital. We want you to enjoy your time inside of the hospital. We want you to pursue opportunities for health and wellness. Our goal is for you to graduate feeling happy and grateful for your training and completely free of burnout. We don't want to burn anybody out here. And we want to provide an environment that again, that's diverse, that's inclusive. I think that's something that we've already been doing with our fellowships and our other educational experiences, and we're just looking forward to expanding that into our residency.
And also to develop lifelong skills, not just have health, be healthy and well in your residency, but also have the skill set to do everything that we talked about in the previous slides, yet maintain your own personal physical and mental health. And so that's something that we do as faculty, and we plan on teaching you to do as well.
And I think this is to say that we want you to feel supported. I mean, I want you to feel like if you need help, you can ask for it. I want you to feel like if you're tired and you need rest, you just tell us and you'll get it. I don't want this to be like a malignant or negative experience. The goal is for you to feel supported while you're going through a stressful period in your life and training to be an orthopedic surgeon. Sure, there's going to be some stress, but I want you to feel that you have support from all of us to get through that. And that's why this is a big aim in our program, is that's something that I think is critically important. I mean, if you finish residency and you're already burnt out and tired, it's very difficult to make it in practice.
That's right.
So now we're going to sort of shift gears and talk a little bit about the residency program. The leadership structure of the residency. So our chair is Joseph Moscow, MD. He's a total joint surgeon. He's a great guy. This residency is something that he's extremely committed to. This is something that he's been thinking about for a very long time. He's like on cloud nine since we got it. So he's going to be incredibly supportive. He's really excited about the residencies, and he's been great to work with through this process. John Carmouche is our vice chair. He's a spine surgeon, great guy, easy to talk to. Again, also very supportive of the residency. And I think that's something that you want to hear any place you're interviewing. You want to know that the chair and the vice chair are supportive of the program. And I can tell you that they're incredibly supportive of this program and ready to make it a big priority in everything that we do. I'm Jesse Seamon. I'm the program director. I'm talking to you right now, and I'm pictured here in the bottom left. And then Peter, who's on here with me, is in the bottom right. And if you can't tell, he and I are really excited about this residency and can't wait to get things started. Department facts and figures, just some things to talk about with the residency. We're going to have 4 residents per class. So in 5 years, when the residency's full, we'll have 20. I think it's important to say that what we're looking for this year is to fill the PGY1 class, our first class. We have no plans to take residents out of sequence or to try to fill PGY 2, 3, 4, or 5 slots from outside programs or other applicants. We're going to start with an intern class, and then we're going to build on that each year with our newly matched class. And so we're really excited to get this started. Adjacent to our orthopedic residency, we have the pediatry residency. Randy Clements is the program director, and we'll see a little more about him later, but they have 3 residents per class. It's a 3-year program, so there's also 9 podiatry residents. We have 2 adult reconstruction fellows, 1 hand fellow, 1 spine fellow, and 3 research fellows. And so that's just kind of a background about the learners that we have. In addition to this, of course, we have medical students and PA students. And we have a robust group of inpatient ACPs. I've got 16 inpatient ACPs. There's a huge amount of support there, and they're all great to work with. Going to the faculty, I'm just going to kind of go section by section. So trauma, there's 5 of us in this section. I'm a traumatologist, so I know these guys really well. This is a great group of people. We're all really good friends. And
you guys out at a bar together?
Yeah, this is like a rare. Every time all 5 of us are together, we always take a picture because it only happens like once every 5 years because one of us is usually on call or at the hospital doing something. So anytime there's like a rare moment where we're not, we always snap a photo. I think we were actually interviewing someone during this photo. This is our sports faculty. We have 4 surgeons. This is an incredibly busy section of incredibly skilled surgeons. They do the full breadth of like orthopedic sports, anything you can think of, they do it. And this is a great group of people and super fun to work with. Pediatric orthopedics, Peter could tell you more. He's in that section, but Grace.
There's 3 of us
Blaylock,
total, yeah.
Yep, 3 guys.
Dr. Blaylock, Dr. Zielinski, and then me.
Yep,
they're full time. I'm only part time.
Yeah, you got your hand responsibilities.
Yeah, I got to do hand and research and help run this program. Help you.
That's right. Well, I need it. Here's our hand section, and so this is another great group of people that are really fun to work with, and incredibly busy. I think the hand volume and the trauma volume at Carilion are enormous, and so. this is a great section and great group of people to work with. We have five hand surgeons here. In terms of spine, we have 4 surgeons, and they're another great group. I might keep saying it, but one thing while we're talking about faculty that I think is important to bring up is that everybody gets along really well in this department. I mean, I think we're some of us are really close friends, but I think we're all friends in general. I mean, everybody gets along really well and likes working together. And so this is our spine team. This is adult reconstruction. 5 surgeons, busy. Another great group. So we have a lot of orthopedic surgeons here. And Peter, you probably
these are the foot and ankle guys. I help teach somewhat in the foot and ankle residency program. We've got Ryan Putnam, Randy Clements, Blaine Patton, Corey Fiedler, and Jason Naldo. The podiatry residents work with the ortho program a lot. They take a lot of the foot and ankle call, and they rotate on our service. And so we work with the podiatry and the foot and ankle service quite a bit.
Yeah, it's great. It's a great group of surgeons for sure. So this is CNRV, faculty or Carilion River Valley. So remember, this is a site that will rotate out as a PGY4 for 3 months during the daytime. So Ryan Harris is an adult reconstruction surgeon, and he's our site director. And then Chris Catterson, top middle, ortho sports surgeon, and does the Virginia Tech and Radford University coverage. There's also John Marr, Christopher Knight, and Jason Naldo. So again, just a good group of people and an opportunity to get a little bit more of a smaller hospital perspective while you're down there, but also an opportunity to do some pretty big time sports coverage and see a lot of that, which I think is an important part of training.
So the oncology experience is going to be integrated throughout the residency. I actually do a fair number of sarcomas. This is a synovial sarcoma here in the knee. We have tumor board every other Friday, which is a resident you'll get to be a part of to hear the sarcoma cases presented. There's also sarcoma cases, throughout other rotations. In ortho hand, there's benign tumors in addition to the sarcomas that you'll do with me. Ortho trauma takes care of the majority of the metastatic lesions since they tend to come through the hospital. And then the adult reconstruction service gets involved when we do megaprostheses for metastatic lesions, either of the acetabulum or distal femur replacements or proximal femur replacements.
Yeah, and I think just talking about that, Peter, I mean, just coming at it from a traumatology perspective, we do a fair, it's probably about, at least once a month that we've got a metastatic lesion that requires an IM nail. So it's not infrequent to see those here.
Mm-hmm. So here's the follow-up on those 2 slides you saw earlier. This is a big knee resection that I did with John Tuttle. You can see we had to take everything down to the knee. He did the MCL reconstruction, and then with the plastics group, we did the reconstruction with the flap. But overall, so we do take care of some big and complex cases here, including the one illustrated in these slides. But overall, our volume, we did 164 total oncologic cases in the last academic year. You can see the breakdown here. The ACGME minimum is only 10 cases, and so really the residents will have no trouble meeting those minimums. And then to round out our orthopedic oncology education, we'll have visiting lecturers each year from visiting faculty.
So yeah, I think that the point on that is to say that we can offer a pretty robust oncology experience here. So I don't want anyone to be concerned about the lack of sort of a dedicated oncologist. Well, we certainly have plenty of oncology cases and more than enough to meet the minimums. So now we're just going to get into some nuts and bolts. None of this has to be memorized, but just want to give you sort of a general overview of what the rotations are going to look like. So during the PGY 1 year, you will do 6 ortho blocks. There's also a surgical skills block where you will learn a lot of your basic surgical skills at the Sim Center. And this isn't just like sewing. I mean, this is like draping, setting up an OR, using a C-arm, learning how to splint, cast. So it'll be a really cool block, and we're really excited about that. And Natalie Vaughn, one of our hand surgeons, is going to kind of lead the way on that. So I think that's going to be pretty fun. And then there'll be 6 off-service blocks, which is part of your intern year experience: vascular surgery, plastic surgery, a medicine block, surgical ICU, and an anesthesia block. So kind of pretty good intern year. As we get into the PGY 2 through 5 rotations, I think you're going to generally see similar things everywhere, but you'll do trauma as a PGY 2, 3, and 5, joints as a 2, 4, and 5, sports as a 2, 3, and 5, peds as a PGY 2 and 5, spine as a PGY 2 and a 4. You'll do some foot and ankle blocks during your 3rd and 4th year. We're also going to include a research block during the 3rd year, and an elective block during the 4th year if there's something that you want to kind of circle back on and do a little bit more work or get a little bit more experience in it. In terms of evaluation of the residents, I think, and Peter can touch on this too, but evaluation of residents is going to be something that's very, very important to us. And the reason for that is that I think that it's critical as educators that we have frequent and productive evaluations and discussions frequently, so that there's feedback and people know how they're doing and they understand where they can improve and also where they're doing well. And so for all programs, the evaluation starts with the ACGME core competencies: patient care and medical knowledge, professionalism and communication skills, practice-based learning, and system-based practice. But we also think that it's important that there's sort of like a little bit more real-time evaluation. So a lot of the competencies focus on the end of the block, but we want to debrief with a resident at the end of each procedure. We'll probably incorporate the MyTip report tool or something similar, so that you can request sort of immediate feedback evaluations after you've done a surgical case for your resident portfolio, which is something I'll review with you formally every 6 months. You'll get global assessment forms from faculty. We'll do patient experience surveys, 360 feedback from staff, et cetera. And like I say, we use this to create a portfolio to evaluate you formally twice per year, but you're going to be talking with the people you work with a lot more often than that. And so feedback's just something that, again, that is just going to be something that was really important to us. We really want to make sure you're getting great evaluations, that you really know where you stand, so that you can get the most out of your rotations and your learning experience. Now we sort of get into the didactic schedule, and this is something that both Peter and I are pretty passionate about. We kind of have a little mock-up here of what the schedule will be, when you get here. So I'm sort of just going to do kind of a broad overview. So Monday is sort of the weekend sign out. Tuesday and Thursday will be section-specific conferences. Wednesday is kind of our mega conference, to use the term. So on Wednesday, we have conference from 6 a.m. to noon. We will just have you in the lecture so you can really learn. I think learning is a big part of being a resident, and we wanted to sort of like make that dedicated time, that dedicated 6-hour period, to make sure you're getting all the orthopedic knowledge that you need. A big part of the Wednesday conference is the core orthopedic resident education, core for short. This is 100 topics that'll repeat every 2 years, and a lot of this is going to be high-value topics that you're going to see in your board exams and OITE. We'll also have an applied learning conference, which will be 4 hours on the Wednesday from 8 to 12. And this will be various topics which we'll go through, but it's going to include anatomy and skill sessions. This will always be given by faculty, where some of the core conferences will be given by a resident with faculty oversight ultimately. But obviously,
if they have an interest area, yeah.
Yeah, exactly.
It gives you a chance. Yeah, if you're interested in it, you give the talk on it,
Yeah, but obviously when it's first starting and all you guys are going to be PGY ones, you won't be ready to give those lectures yet. So as it starts, it'll be faculty giving those. But as you learn more and become a second and third year, you're sort of advanced to a level where you'll get the opportunity to give those lectures to your colleagues, which is a great way to learn. Again, just getting into the weeds with it a little bit more. So Monday is what we call the weekend review conference. This is just a review of all the weekend cases with an academic discussion about it. It kind of focuses on call as a specialty. So we just finished a call weekend, and there's been a lot of cases that have come in, and this is an opportunity to sort of decompress and talk about it with everybody there and just kind of learn, practice-based learn about the cases that we did and saw, case-based discussions. This is what Monday is going to be all about. Again, the Tuesdays are service-specific or section-specific, and this is going to be pre-op and post-op planning. This can be journal club. This may be some section-specific lectures. We're going to leave that at sort of the discretion of the section education director.
Mm-hmm.
The Wednesday conference, we sort of just dove into a little bit, but this is just kind of showing you the core conference. I mean, there's 100 topics. I don't expect any of you to read or memorize all of these, but this is just to show you that Dr. Apel and I have already planned all this out and thought about this quite a bit and have these topics ready to go. At 7 a.m., we have a departmental conference from 7 to 8. And this is going to be things like grand rounds, visiting professors, peer reviews, what's new in hand, what's new in foot and ankle, what's new in trauma, et cetera, et cetera. These are sort of these department-wide meetings. Every so often, it'll be the department meeting from 7 to 8, which will give you guys like a little break to go get some breakfast. And then from 8 to 12 is the Applied Learning Conference. And so a lot of this is going to be anatomy, especially the first half of the year. This is going to be on a cadaver, surgical dissections, surgical prosections, just learning about the anatomy in 3D hands-on, which is the best way to learn it. Second half of the year, we work in basic science, ethics, business, and legal topics, research. And so this is sort of where this is this big 4-hour conference for you to really learn a lot about a lot of different things in orthopedics. So the first half is sort of nuts and bolts, anatomy, surgical skills. The second half is more broad, but the basic sciences and ethics, business, legal. So we think we've got a lot of cool topics. This is just kind of, again, not to be memorized, but just to show you that we've thought about it. The anatomy topics, the skill labs topics, ethics, business, and legal, which I think is going to be pretty cool. Some of these lectures, some of the people that we have coming in to do them, it's just an opportunity to learn about some things that aren't maybe classically in the orthopedic realm, but are things that are very important.
Stuff in residency.
Do what?
I never got this stuff in training.
Yeah, I didn't either, and I wish I did. And I think that's why I'm happy that we're making this a big part of sort of the education and learning, because these are things that are, all of these topics listed here to the right are incredibly important and things that need to be talked about and learned about. Mm-hmm. Thursday again would be the section specific conference, and then on Friday you're off, okay, in the morning, not the whole day.
Sort of off.
There's no mandatory Friday conference, so you can maybe you sleep in a little bit. You could also use this for OITE and ABOS prep time. Sometimes this will be for meetings with the program director. So sometimes this will be semi-annual reviews, but other times you may have some questions or some concerns or some things that you want to talk about, and I'll be available on those mornings to meet with you if you want to or need to. Kind of transitioning from that into the research, quality assurance, and problem-based learning projects. These are other big parts of the residency, just to give you an overview. So we're going to have integrated problem-based learning activities. Every year, you're going to give an annual problem-based learning talk. This is going to be a formal presentation to the department. This will sort of tie into that departmental conference on Wednesday from 7 to 8. It's a 20 to 25-minute talk. It's sort of a deep dive into a single case. So you do a case, maybe something goes wrong, maybe something goes right, but it's something that you want to learn a lot more about. So you identify a faculty mentor, and both of you do a deep dive into it, and you come up with a very detailed evidence-based talk that you're going to give to the department and teach everybody about it. And that's just kind of part of that process of learning to do a deep dive into something, learning to do a deep dive into the evidence and the literature so that you understand the evidence behind everything you're doing. And there'll be a little bit of problem-based learning weekly at your section specific conferences. We've asked all the faculty to spend at least a minute or two on every case, just highlighting the reason why from an evidence-based perspective. So again, that's something that's really going to be tied into it.
Help people know the basis for what the decision is. If you're deciding to do, one surgical procedure over the other, rather than just say, oh, that's my preference, as a faculty, and let that be the answer. The answer needs to be, well, this is the reason for it. And that's integrated throughout, like Dr. Seamon said.
Yeah, absolutely. And this kind of ties into the quality assurance, quality improvement project. So this is an ACGME requirement, but we want you to recognize and prepare cases for peer review. You'll identify one quality improvement or quality assessment, quality assurance project per year. These can be small scale or retrospective projects. You'll identify a clinical faculty mentor. This will probably come about organically. I mean, you'll be involved in a case where there's an infection, or you'll be involved in the case where there's a complication. And what this is you'll sort of identify what that complication was, and you'll work with our OR quality and hospital quality teams and your faculty mentor to really look into that. So, for example, if you had a case that was an infection, you may do a deep dive into that with the quality team. Like, how many infections on this type of case have we had in the past year, and like, how do we get those numbers and how do we present that? How do we find that information? So this is kind of working through the quality side of things, which is incredibly important. Peer review is incredibly important. And so being able to identify complications is the first step. But the second step is being able to make it so they don't happen anymore, and being able to understand how to work within your institution to find this data, right? Like, how many infections are we having a year? If we're using an implant and we're finding that the screws are breaking, how do we report that? Who do we work with to do that? That's what this quality assurance and quality improvement's all about. And so each year you're going to be expected to find a case like that you're involved in, and sort of do a deep dive into it in that way. And this will sort of culminate in a 10 to 15 minute presentation that may be given at a section specific meeting on that service, or it may be given at a departmental level, like at our peer review conference, depending on what it is and the magnitude of the problem. So the research component is something I'm going to let Peter talk about, because that's his
near and dear to my heart.
Yeah.
So the research component, is a longitudinal component of the residency program. And so the didactic education curriculum, the lectures and the clinical experience that you'll have should spark curiosity. This procedure versus that procedure, this implant versus that implant, operative versus non-operative. The clinical questions come up all the time. So we're going to encourage the residents to explore and develop a research idea. And so part of what my job will be as, the research director is to identify those ideas that the resident has and then help to develop them out with using the resources from Merck, making sure that, IRBs get done. If there's clinical data that needs to be collected, we have mechanisms for that, so that this longitudinal research project will make progress at the 5 years. We do expect that by the end of the 5 years that the research will culminate in a publishable quality of data, either in an abstract or in a manuscript form. The goal is that the resident will have time to make progress on this research block during the PGY3 year, during those 11 weeks, because the groundwork will have been laid beforehand. And, as I stated before, the resources of Merck will help to assist to get this project to move along and to make progress.
I think that's exactly right, Peter. I mean, we have a huge amount of research support here now. And I think that research is an important part of being a resident, being involved in projects, tackling clinical problems. That's like a huge part of your residency. That needs to be a big part of your residency. Not just because you want to buff up your CV and get great fellowships, which is also important, but because it's learning to think that way. It's learning to, how does it work when I have a clinical problem to make it into a research project? How do I do that? And if you end up going somewhere where that infrastructure isn't in place, now you know what you need to get it in place. So I think this is something that's really, really important, and something that we can really offer here, is that we've got a really developed sort of research group now and a lot of support. So I think that there won't be anybody that doesn't get a couple publications at least during their residency, if not more. And so I think this is something that we're really excited about. So kind of shifting gears away from the sort of nuts and bolts of the residency to talking about Roanoke, we're going to send you a separate video that's kind of like goes into a little bit more detail about all the things there is to do in Roanoke. But I'm probably a little biased. I grew up in Roanoke, so I absolutely love it here. But I think
I love it too, and I didn't grow up here.
That's right. So it's not just for people who grew up here, but I think like one of the great things about Roanoke is the outdoor activities. It's kind of like an outdoor paradise. There is 400 miles of paved and natural surface trails, basically just in Roanoke. These are great for biking, running, and walking. This is the Roanoke Valley Greenway. You're kind of seeing a picture here on the right. So this is the Greenway here, and then you can see the hospital in the background. So essentially, you can step out of the hospital parking garage, take 5 steps across the street, and you're on the Greenway. So, which is great because the part of the Greenway by the hospital runs. If you take it from one end to another, I mean, it's like over 20 miles. So there's a huge amount of easy access trail right by the hospital. And it runs continuously for 14 miles. So if you went out and back, it'd be 28 miles. So a good bike ride and a marathon if you ran it. I don't think you'll have enough time to run a marathon during the day, but there's plenty of stuff to do. And so the Greenway is a huge part of Roanoke. And like I said, the Greenway is over 400 miles of paved natural surface trail. So this is a really, really developed Greenway, and it's really nice. There's the Mill Mountain in the trail system. So I've talked about Mill Mountain twice in this talk. So the hospital sits at the base of Mill Mountain. This picture on the right is showing you the top of Mill Mountain where the Roanoke Star is, which is a locally sort of famous landmark. There's like an awesome view from up there. It's really fun to do the trails or even take the road up to the top. I mean, it's a great workout either way, whether it's a hike or a walk or a run or a bike ride. And so you'll see a lot of us out there. Roanoke's a great town for mountain biking. There's a huge number of mountain biking trails, huge number of running trails. Just on Mill Mountain alone, there's 10 continuous miles of trail runs for hike and bike. And you can literally jog 2 minutes and you can like get on the road going straight up to it. So it's really cool to have that. We have the Blue Ridge Parkway, which is just 5 minutes from the hospital, just past Mill Mountain. This is great for biking or just doing a scenic drive. There's over 1,000 miles of hiking trails in the region. And the Blue Ridge Parkway is a 470-mile continuous road that passes directly through Roanoke and connects to many great towns and cities. So this is another just great outdoor thing that's right by the hospital, right in town. For those of you that like hiking, which based on your CVs, a large number of you do, there's essentially too many to count options for long or short hikes for any level. Many of the hikes are part of the Appalachian Trail. And again, there's 1,000 miles of easily accessible hiking trails. So I don't think you could do them all if you wanted to, but there's a lot of famous hikes here. Up at the top right is McAfee Knob, a super famous hike on the Appalachian Trail. Dragon Tooth, Sharp Top, Tinker Cliffs, the Virginia Triple Crown Loops. There's tons of hiking for people that like that. And if you don't like it, when you get here, you'll probably start liking it because it's something that really everybody embraces and enjoys doing. Just
taking my kids to Tinker Creek.
Yeah, no, I'm telling you, these hikes, it's incredible. And like I said, it's a friendly group of people out there on the trails too. So I think it's really fun. And so just various logos about all the outdoor stuff there is to do in Roanoke. And there's a lot of other things to do in Roanoke too. I mean, it's not just outdoor stuff, but so many people on their CVs talked about how much they love doing outdoor activities. So I wanted to make sure I highlighted that this is just an outdoor activity paradise. And I'm somebody that really, really loves the outdoors, pretty avid outdoorsman, and love doing things outside. And I mean, I've been here a long time and I haven't done it all. So it's really fun. I mean, and like we were saying, Peter, it's not just outdoor activities. There's a lot of good restaurants here. There's a fair number of like wineries in the area and the surrounding areas. There's the Mill Mountain Theater if you like live plays. I mean, I think it's got everything you need in town. The airport's pretty good, not hard to fly places. Anything you want to add, Peter, as somebody who's not sort of a native Roanoker?
Yeah, it's a great place for families, and that's something that we, really were looking for when we came here was that it's manageable. There's no traffic. Schools are great, and there's plenty to do.
So I guess this just kind of takes us towards the end part of our talk, and that's, why should you do your residency here? Because, ultimately we're recruiting you. And I think the first thing is it's an excellent surgical education and hands-on experience with high volume of cases. I mean, at the end of the day, that's one of the most important things about your residency. You got to do a lot of cases. You got to get your hands on them, right? So it doesn't do you any good to be there if you can't actually participate in a significant way. We can offer you both. Okay, so we want you to participate. We want you to have a big hand in all the cases that we do. We're very comfortable with that. So we can offer that. We've got a long history of educating residents and fellows. So we're a new program for orthopedic residency, but we are not new to orthopedic education. Like I said, we've had the UVA residents for more than 50 years. at the PGY 3 and 4 level. So we've taken them through a huge number of cases. They have the fellowships in adult reconstruction and hand and spine. So we've got a pretty strong educational background. I think we're an academic medical center. I don't think we really fall under the category of community center. Our volume's too high and we're too academically oriented. So I think we really are an academic medical center. We have a faculty that loves orthopedic surgery. Like, at the end of the day, to do this job, you have to love it. You got to love orthopedics. And we have a group of faculty that all love it. It's important to them. We're focused on education and serving our community. And those things go hand in hand, but that goes across the whole department. So you've got faculty that they want to educate you. They enjoy doing it. That's why they're here. And they love orthopedic surgery. So I think that's important. And we all get along. We're all friends. So you're not going to have to deal with faculty fighting or conflicts or things like that. We all like each other. Last thing is we've got robust ACP support. So remember, all these years, we've only had 4 residents down here rotating. So we've not really relied on the residents to do anything. And so because of that, we've built up a strong ACP support network. So a lot of our practices function independent of residents. And so the residents get to be somebody that is there to be educated. And that's how we look at it. You're not here to do scut work. You're not here to see every single patient in the hospital for us. You're here to learn. Now, part of learning orthopedics is working hard. And so I'm not going to sit here and say there's not going to be a lot of hard work to be a resident, because it is, but you're going to be supported. You know, we have a lot of support, a lot of ACP assistance and help. The ACPs are great. Like I said, by the time you guys get here, there's going to be 16 of them in the hospital side of things. And so we're all going to work together. But the point is to say that this is first and foremost an educational experience, not a labor experience. We're here to serve you, not you to serve us. That's how I look at it. We're here to serve you, educate you, teach you to be great orthopedic surgeons. We don't expect you to do, hard labor in exchange. I think taking care of patients, taking call, that's part of being an orthopedic surgeon, and those are things you have to learn. So you're definitely going to do that, but it's not going to be a lot of scut work. Just kind of along that same vein. I mean, again, you're going to work hard, but our focus is really on a balanced experience. We want you to be happy and resilient when you graduate. So this is one of our hand fellows, out for a drink.
That's Max.
Yeah, that's right. And some resident surgeons in the OR glaring at the camera. And this is myself and a couple of my trauma partners with the last 4 UVA residents to rotate here. I think this was actually taken a few days before their last rotation here ended, but here we are up on the heliport.
Look at the view from there, huh? Look at that.
Man, the view from the heliport's incredible. It really is. Which we'll show them on a tour. This is a smaller town with big city volume. Which I think is important, because you're going to get big city volume at this hospital, but you're not going to have to live in a big city to do it. The hospital's in a safe area. You can step outside and go running or hiking or whatever you want to do. The cost of living is not high, right? It's actually low. And I think it's great for families, or individuals. I mean, here's some more photos. So that's me, I think, shortly after I got into practice catching a fish. That was out in the lake.
That picture.
I was going to say, Dr. Apel took that picture. There was a bunch of us that got together, actually, went out on the lake. So Smith Mountain Lake's only about 45 minutes from here. It's a really nice lake. A lot of fun outdoor and water activities to do there. I probably should have mentioned that more in the talk, but so that was really fun. And this is Dr. Koob's here and Dr. Apel and his family, both their families. This is an older picture because the kids are really young, but
I know they're big now.
Yeah, having a good time. And this is me and Dr. Caniglione in the trauma section. So we just had both finished pretty big days of operating and went for a run. So this was us getting back. I think Dr. Carmouche actually took that picture. But point being, smaller town, we all like each other. We all get along. And but we have this sort of unique distinction of having really big city volumes. I think that's a nice combination in a training site. And I'll go back, but I think that sort of concludes our talk. And I want to thank all of you for taking the time to listen to it. I want to thank you for being interested in our program. We're certainly looking forward to getting the opportunity to interview you. And I'm sure after you've seen this talk from Peter and I, you may have some questions or things that you want us to answer. And I want to encourage you to bring those questions with you to the interview. We'll be happy to answer those. Happy to answer any other questions you have. Reach out to us over email. This is something that we're really passionate about. We feel really privileged to have this residency. We're really looking forward to training new residents and getting this going. So again, thanks for the attention and looking forward to seeing everybody soon.
Thanks, everybody.